Hello, my name is Abby Maisie and I am a diabetes clinical nurse specialist studying at the University of South Glamorgan for a postgraduate diploma in diabetes. Today I am going to be talking about macrovascular disease and its effect on the diabetic foot. Macrovascular disease refers to the narrowing or blockage of the large blood vessels caused by atherosclerosis. It is the primary cause of death in diabetes and is 2 to 4 times more likely to occur in people with diabetes than without. Diagnosis: 50% of people with type 2 diabetes will show signs of one or more. Common macrovascular diseases you may be familiar with are heart attacks, strokes, kidney disease, and diseases affecting the circulation system, such as peripheral vascular disease. So how does macrovascular disease occur? A buildup of fatty deposits and blood clots known as plaques cause hardening and narrowing of the vessel walls. Heart attacks or strokes will occur if the plaques break off the artery wall and cause partial or total blockage of the vessels. This diagram demonstrates this. It is a little like pouring hot fat down the plug hole of the sink. Eventually it will build up on the wall of the drain, obstructing the flow of water or blocking it altogether. So, what are the risk factors that you can change? Smoking doubles the risk of macrovascular disease, so it's very important to stop smoking if you do. Obesity is a major risk factor in the development of both diabetes and heart disease. A diet high in saturated fat raises the cholesterol, which leads to an increased risk of heart disease and stroke, and being physically inactive increases the risk of these diseases by 50%. Maintaining a near normal blood glucose level decreases the risk of heart disease, and even a 1% reduction of your long-term blood glucose level is associated with a 14% decrease in heart attacks. A raised blood pressure is the biggest risk factor for stroke and plays a significant role in the cause of heart attacks also. However, there are some risk factors that you cannot change. Unfortunately, you can't choose your genes. Family history and ethnicity may put you at an increased risk for macrovascular disease, and simply getting older increases the risk of heart disease, and the risk of stroke doubles every decade after the age of 55. Men are at greater risk of heart disease, but after the menopause, the risks are similar for both men and women. What can you do to reduce your risks? Eat a healthy, balanced diet. Aim for 5 to 7 portions of fruit and vegetables a day, and limit your dairy products and meat. Maintain a healthy weight. A BMI of between 18 and less than 25 is considered to be a healthy weight. Avoid saturated fats. Eat at least 2 portions of oily fish a week, and limit your salt intake. And avoid processed food. As I've said before, if you smoke, stop smoking. Engage in regular physical activity. Aim for 30 minutes a day at around 5 times a week. This doesn't have to be joining the gym. It could be brisk walking, housework, gardening, anything which makes you slightly warm and out of breath. Limit your alcohol intake. Remember, no more than 14 units per week for a woman and 21 units for a man. And always have at least 2 alcohol-free days per week. Ensure you take all medication regularly. You may be taking blood pressure medication and cholesterol tablets and even aspirin. Keep all doctor's appointments at the surgery or hospital. And finally, learn as much as you can about your condition. Many hospitals offer structured education programs, so take advantage of them and manage your own condition. So we've had an overview of what macrovascular disease is and how it occurs, and what can be done to prevent it or reduce the risks of developing it. Let us focus on one element: the diabetic foot. So how does macrovascular disease affect the foot? Prolonged high blood glucose levels lead to nerve damage, which leads to loss of sensation or feeling, which can result in injury to the foot. As we've already discussed, atherosclerosis can lead to poor blood supply in the arteries, and the blood supply to the feet can be affected, making it difficult for infections to heal, and smoking will make it much worse. Some common diabetic foot complications are calluses, corns, blisters, ingrown toenails, dry cracked heels, ulcers, and sadly sometimes amputation. Here are some visual diagrams of those conditions, and these will have occurred because of neuropathy, ischemia, or both. People with diabetes should be encouraged to inspect their feet every day. You're looking for signs of blistering, redness, corns, calluses or dried skin, paying particular attention to in between the toes. If you are unable to do this for yourself, use a hand mirror to look at the sole of the foot. You should wash your feet every day in warm soapy water, paying attention to the heat of the water, as you may not be able to detect the extremities of heat. Complications can arise from poor hygiene. When drying the foot, use a patting motion rather than a brisk rubbing motion, which may cause friction and tear the skin. Again, pay particular attention to drying in between the toes, as you want to avoid infections such as athlete's foot occurring. Take the opportunity to examine the toenails. When cutting the toenails, cut straight across, not down the sides, as this will encourage ingrowing toenails, which again can lead to infection. When you have cut the toenails, file with an emery board until smooth. When the feet are dry, take a thin layer of emollient and apply to the top of the foot and to the sole, paying particular attention to the heels, which are susceptible to becoming dry and cracked. Take care not to rub the cream in between the toes, as you do not want this area to become wet and moist, leading to infection. If you are ever concerned about redness or blistering of the foot, contact a healthcare professional sooner rather than later, as foot complications develop quickly in diabetic patients. When wearing socks, you may want to turn the sock inside out so that the seam is not directly against the toes, or have seamless socks. Inspect your footwear on a daily basis also, making sure there are no foreign objects inside the shoe or any nails sticking through, as you may be unaware and could cause damage to the foot. Try not to walk around barefoot, as again you may step on something which can cause damage to the foot. Avoid the use of hot water bottles and foot spas and anything where you are unable to detect extremities of heat. So to summarise, inspect your feet daily, wash and dry regularly, paying attention to in between the toes. Use an emollient to prevent dry skin and cracking, and do not apply in between the toes. Cut toenails straight across. Do not walk barefoot, and inspect your footwear regularly for foreign bodies or damage. Avoid hot water bottles, foot spas and sitting too close to the fire. Attend your diabetes annual review for foot inspection, and do not deal with foot problems by yourself. Contact a healthcare professional. Thank you.